Okay, so now we will be looking at nephrotic syndrome. Nephrotic syndrome is defined as it is combination of glomerular syndromes characterized by massive proteinuria, loss of proteins in urine greater than 3.5 gram per, and hypoalbuminemia, generalized edema, hyperlipidemia, and lipiduria. So these are collective findings in nephrotic syndrome. Causes of nephrotic syndrome are primary glomerular disease, includes minimal chain disease, membranous glomerulopathy, membranoproliferative glomerulonephritis, and focal segmental glomerulosclerosis. Systemic disease involved in nephrotic syndrome are diabetes mellitus, SLE, amyloidosis, and choroglobulinemia. Now, workup or test will be urine lysis, renal biopsy, and proteinuria is estimated for 24-hour protein excretion. Urine albumin ratio is assessed. Treatment will be general measure protein supplementation, diuretics for edema, treat hyperlipidemia with statins, and sodium restriction should be done. SC inhibitors should be specific measures should be taken. SC inhibitors, they decrease proteinuria, primary glomerular disease for steroids, and secondary glomerular disease treated underlying cause. And if there are infection, antibiotics should be given, and for thromboembolism, anticoagulants should be given. Now, the first disease of nephrotic syndrome is minimal chain disease, also known as lipid nephrosis. Most common cause of nephrotic syndrome in children is minimal chain disease and cytokine mediated mechanism of glomerular basement membrane damage, and it results in loss of negative charge molecules into the urine. Now it is associated with respiratory infection, immunization, atopic disorder, Hodgkin disease, and NSAIDs use. Difference between other nephrotic syndrome, this disease is highly selective proteinuria occurs, no hypertension, no progressive renal failure with excellent response to corticosteroids occur in this disease. Morphology is light microscopy, fluorescent microscopy, electron microscopy. Now, membranous glomerulopathy is most common cause of nephrotic syndrome and in adults, and it is a form of chronic immune complex mediated disease. Idiopathic, its causes are idiopathic, are drugs like captopril, penicillin, gold can cause this disease, autoimmune infections, and malignancy can cause this disease. Features are non-selective proteinuria, hypertension, progression to renal failure, and no good response to corticosteroids. Renal biopsy is performed like electron microscopy shows spike and dome appearance, and in this way, this disease is present. Another disease of nephrotic syndrome is focal segmental glomerulosclerosis, in which sclerosis occurs and only segment of glomeruli is affected. Its causes are idiopathic, HIV, nephropathy, heroin addict, sickle cell disease, and massive obesity. Now, different from minimal chain diseases, highly selective proteinuria, hypertension, progressive renal failure, and poor response to corticosteroids. Clinical features are young male with uncontrolled hypertension give rise to this disease, and renal biopsy shows sclerosis and capillary tufts. Membranoproliferative disease or glomerulonephritis is glomerular disease, a principal mode of presentation. Type 1 membranoproliferative glomerular disease results from both classic and alternative types, and common type associated with hepatitis B, C, and choroglobulinemia. Type 2 is associated with dense deposition disease, C3 nephritic factor, and in this way it is associated. Now, laboratory investigation will renal biopsy shows subendothelial deposit and intramembranous deposits. And the another disease is renal amyloidosis, in which amyloid protein accumulated in the kidney, and then patient gives may have multiple myeloma, Waldenstein, macroglobulinemia, chronic inflammatory disease, inflammatory bowel disease, rheumatoid arthritis, and tuberculosis. So, treatment of nephrotic syndrome, treat the underlying cause and give prednisolone dosage, and uh, melphalan with bone marrow transplantation should be given. So, in this way, we can treat nephrotic.